Doctors of Reddit, what are the craziest excuses you get for people putting things up their butt? When I was first interning at a trauma center, a dude said he went to his daughter's bathroom since his wife was taking a while in the shower. Says he slipped and up into his ass goes his daughter's whole Barbie doll. When we did the x-ray, we saw Barbie. Not only was she way up in there, but her arms were straight up and hair was everywhere. It really looked like she was having a grand time. Dude was found laying face down on his couch, completely naked, with a fishtail sticking out from between his cheeks. Firefighters and paramedics were trying their best to not laugh. He never gave an excuse. All he said was, it was frozen when it went in. The fish thawed up his ass and the scales made it so he couldn't pull it back out. He ended up needing ass surgery to remove the fish. Also, to top it off, like I said, everyone was trying to be professional, but just before the ambulance doors closed to take him to the hospital, one of the firefighters pokes his head in and said, next time don't play with your food, buddy. At this point no one can keep from laughing and everyone except the patient loses their composure. The patient tried to sue the ambulance company for not being professional but soon realized it would mean this entire incident would go public and change his mind. Shaving cream can. Not a small one. He didn't have an excuse, and he was rather proud of himself. He asked for a copy of the x-ray. Flared ends. People. Flared ends. My personal favorite was a dude who clearly had a golf ball up there after I checked on PR exam. Yes, my finger was up his butt. Me. So you've got a golf ball up there? Him. Yeah, but that'll come out easy. It's the cue ball in there that I need you to get out for me. He said that he'd heard that mangoes are good for hemorrhoids. He did the only logical thing when armed with this information. Mango up the butt. It required wriggly forceps to get it out. Good times. At least he admitted to putting it there. That's a step in the right direction. Not a doctor, but an amusing story nonetheless. A friend of mine was downstairs in her living room watching TV after putting the kids to bed. Her young son suddenly appears at the top of the stairs and starts calling for her. She asks him what's wrong and he proceeds to say, "Mummy, I wasn't sure whether to put the Lego up my willy or up my bum. So I put it in my bum, but now I've lost it. A choice no one should want or need to make." Fortunately, after a quick trip to hospital he passed the Lego and no harm came of it, and his sister was bribed not to tell her school friends with copious amounts of ice cream. In the hospital I worked in through university, word used to get around pretty quick when someone came in with something up their butt. They always said that they fell on it. One was a tennis ball, and he said he was watching tennis on TV while naked and playing with tennis balls, then fell on one. We always joked about how sick people can be, until one day a guy came in with an apple up there. Of course he fell on it. Detectives later came to interview him. When we became aware of their theory that it was there because he owed the wrong people money, it all became a lot less funny. Not a doctor, but we did have a guy many years ago with a butternut squash lodged in his rectum. No excuses. His fetish was well known as he was a frequent flyer. What's the diameter of his butthole? Obligatory, not the butt, but the urethra. Used to have a repeat offender who would make frequent visits to our. He used to like to stick things in his dong. Pencils, pens, straws, etc. The last time we saw him he had inserted 1/2-inch drywall screws into his urethra, manually, with a Phillips head screwdriver. He kindly brought the screwdriver with him, just in case we didn't have the right tools. After surgery to remove the screws, he wound up with a suprapubic catheter. Lost track of him after the screw incident. He never complained of pain, was always polite and thankful. Just a weird fetish, I guess. And yes, he was referred to psych many times. My ex-girlfriend is a nurse in a +E, the British version of the year, and she came home with all sorts of weird and wonderful stories. One that stands out is of a guy that came in with a rubber snake firmly lodged in his beige daisy, like whole way up there, nothing dangling. He apparently had some pretty weird friends who made him shove it up there as a forfeit during a drinking game. Okay, alcohol makes you do some weird crap, but this guy, and his brother's rubber snake, survived the incident. Another nurse eventually got it out of him that he had tried again at a later date. I guess it awakened something in him, and liked the feeling, so kept slithering it up there with the intention to pull it out. I guess like some anal bead type thing. But he got it almost the whole way, and his ass did that weird winking thing, and it all went inside, almost never to return. This all happened in Scotland. Strange people, and I guess very open to sharing. Father is a surgeon. Here are some of my favorite dinner time tales. First story he told me was pretty funny. Guy came in with a whole wrapped Pepperidge Farm summer sausage stuck inside. Dad said basically they just needed to attach a clamp to the knot on one end and slowly pull until it eventually came out. Turns out this happened the night of the hospital Christmas party. So before the party, Dad runs to the Pepperidge Farm booth at the mall and buys another sausage. Upon arriving at the party, he found the doctor who attended the procedure and proceeded to rant about people wasting such a great product and started slicing off pieces of sausage and eating it. Also, the story of the guy with an entire set of billiard balls up his ass. They came out in numerical order, so the guy obviously took his time and didn't ignore the small details. People are weird. Not me, but my friend told me this story. When she was a med student, working in the hospital, a male patient came in complaining of stomach pains. Apparently, he was moving very carefully, because she determined that he likely had something in his ass. When they did an x-ray, they saw a stack of Legos in this man's colon, complete with a little Lego person at the top, with his little Lego arm sticking up. She called me on her break to tell me about this, and about how she could never look at Legos the same way. I got her son some Mega Bloks for his birthday shortly after this. It's always I've never done anything like this before, or I met a girl last night who talked me into it. Like, no dude. You don't just go from never doing it before straight into peeled mango followed by a 12-inch rubber dong folded in half. You just don't go from zero to mango. Not a doctor, but have worked in radiology for years. We had a patient come in who had a vibe stuck up his butt and was totally straightforward about it. He said it had been up there for almost 24 hours. He had been trying desperately to get it out but no luck. He was in pretty significant discomfort. Shortly before we went to get him for his X-ray, a note was placed in his chart that essentially said patient states the batteries have finally died and is feeling much better. We of course thought this was hilarious, but we were also very impressed at how long the batteries had lasted. One of the techs joked that she would have to find out what model he had. Had a patient once like this. Small vibe stuck in her butt. I was being all professional, starting the IV, and it was dead silent except the faint humming of the toy. Patient broke the silence and said, "Dang Energizer batteries." So my mother is a radiographer. She once x-rayed a guy who had an entire, unbroken light bulb up his ass. His excuse was that he was putting cream on his hemorrhoids when his dog ran into his legs and he fell backwards onto a lamp. It was taped to a stick, and when they removed it, it had a condom over it. Well, if you're going to fall on a lamp, you might as well put a condom on it. Only logical. Not my patient, but one of my colleagues told me a story about a guy who came to the ER with a cucumber lodged in his ass. He told them he was gardening and fell down onto a cucumber. He was also insisted that the staff not tell his wife about his hospital visit. Friend of a friend is an EMT. Last year he responded to a call for a young teenage boy with rectal bleeding and a colorectal foreign body, which is fansipants medical speak for something lodged in butthole. Turned out to be a 15-year-old boy with a large tree branch stuck in his butt. He had been experimenting. He made a terrible judgment call, and then he had to call 911. He didn't even bring the branch inside, just did it in the yard, which is where they found him, naked from the waist down. He told them he'd been trying to get an all-over tan and the tree fell on him. The EMTs politely pretended that this wasn't the dumbest excuse they'd heard all year. The kid was fine. This is actually statistically very likely to happen. Strong storm blows pants down, tree branch breaks, and thump. Not a doc, but I've had a patient who tried to dislodge their constipation matter by shoving a toothbrush up their rear and it got stuck very far up there. Possibly the worst stench ever when he had to have a colonoscopy. Bro had a guy with 2 baseballs stuck. One was able to come out but the other they had to take to the OR. Once they realized they couldn't take it out with force, had to surgically open the guy. Patient almost ended up with a colostomy due to the damage he caused. That x-ray was interesting. So I'm not an ED attending. I was working in an ED at one point in a very poor neighborhood in New York, and we got a call from them saying we had a disruptive patient coming in. This sort of call gets you ready for what's about to come, or not, as you'll see. About 5 minutes later we hear screaming and yelling come from the ambulance bay. It's just a muffled sound, but we can sense the aggressive nature. In come the patients. The air is loud and busy, and right now it's dead silent for 20 seconds as we are evaluating what rolled in. Mind you, at this point in the way our ED ambulance triage station works, everyone in the ED can see what just came in. It's a very open floor plan. The patient is actually patients. It's a woman laying prone with a man laying on top of her, also prone. A white flat sheet and a mylar blanket are all that's covering them. They are screaming, and I mean unholy language and anger. I honestly don't remember most of it, but I remember that it was one of the few times I think I understood why cursing was invented. There just aren't words yet for some things. So we get them into the room and uncover them. He apparently forcefully inserted himself into her anus and she clamped down with pain. He was well endowed, so it was much harder than you'd imagine to remove himself. The lube, which we think was just spit, had dried. Now the woman really looks like she's in agony. She's got tears, but she's also a dervish of anger. She's laying super still though, and every time he moves she's got nuts. So the attendings, really, cause we had surgery, GI and the rest of the ED staff consulting on this, decide he would sedate the woman and hopefully relax her enough to remove the man. It worked, but not to her benefit, as the man had done a fine mess of her backside and there was copious amounts of blood. She ended up being rushed to the OR and he was later lost to follow up. I don't know what happened to the woman, but I assume she did well or we would have heard about it. Had a kid once come in to see a neurologist. The referring GP gave us one single line, one Lego and the urethra. He was very disturbed and said that he wanted us to just cut his dong off, cause he wanted to be a girl. I have a friend who works in A&E, what we call the A here in the UK, and he had a guy and a girl come in both with each other's wedding rings up their buttholes. Kinda romantic in a weird way. Once upon a time I was a lab assistant in a hospital. One of responsibilities was to take all sorts of things from surgery to pathology. These things ranged from limbs to placenta, as well as items removed from the body, and they came down on a dumbwaiter that alerted us with a siren and flashing lights, so it was a big ordeal. We got all sorts of interesting things, like one time I had to bring a full leg to pathology, which was a lot heavier than one might assume. Anyway, we had a new hire who was super stoked to receive his first item from surgery. So the alarms go off one day and he jumps up, I got it, and the excitement on his face was palpable. He rushes over to the dumbwaiter and in one hand picks up the paperwork and the other, a giant tube of chorizo sausage. We all knew instantly what it was, but being a naive new hire he had a look of puzzlement as his eyes wandered from the tube of chorizo to the paperwork where he read out loud, removed from anal cavity, OMGEW, and drops the meat tube on the ground. I can't remember how long we all laughed for, but for every holiday since he always received a tube of chorizo sausage, no matter who was his secret Santa. Friend and a nurse told me of a time that a man in his 30s comes in to have a glass dong removed because the stopper passed the Rubicon, so to speak. Dude had nothing to hold on to for safe extraction. Dude said, oh, haha, it was my wife's idea. Last time I'll let her try that on me. He was dropped off at the by another man. I work in the air. Guy came in with a light bulb up his ass. Didn't really say how it got up there. You could see it on the x-ray of his pelvis quite clearly. He just told us that he was at a party and mistakes were made. Trouble is, this party ended 3 days before he decided to come in. On the upside, the doc got it out safely in one piece. That thing was frickin' huge though. It was the typical round light bulb shape, only bigger. As soon as it came out, that guy proceeded to have one of the most epic and smelly 3-day overdue dumps ever. Not an doc, but I once consulted on a rubber dong that was lodged in the sigmoid colon. It had literally gone round the bend, which is why the guys needed help. Long story short, we had to scope the patient, camera up the ass. Their excuse, they got drunk and fell onto it. This story isn't that crazy until I tell you the guy was 30 years old, and his devout Christian parents had to come and pick him up because he couldn't drive after we'd finished his procedure. The dong wasn't the only thing that came out that day, if you know what I mean. Medical personnel of Reddit, what was the most uneducated statement a patient has said to you? X's mum recommended I stop taking my antibiotics because antibiotics are bad for you. They kill your antibodies. People who think I am taking their vital signs at 4 AM to make more money. No, you just had open heart surgery 12 hours ago. It's kind of a serious thing. A year ago, before my grandmother died, when a nurse would come in to take her vitals, my grandmother would put up such a fight because she thought the nurse was actually stealing vital signs from her as if they were a tangible object. A mother requested a maternity test for her child. Not a paternity test, but a maternity test. She was convinced that her husband put another woman's semen in her when she was sleeping. You read that correctly. I just remembered a second story. This girl came to the pharmacy to return her birth control. I asked her why. She said she got pregnant. I asked if she took it every day. She said, number. On the days I didn't feel like taking it, I made my BF take it. I couldn't believe the stupidity. I made them answer a bunch of questions until they realized how stupid they were. My friend has just graduated as a doctor and did a placement in Cape Town, down in South Africa. Apparently things get a little crazy on Friday nights, and one night they had a guy come in, presumably in an ambulance, with an axe lodged in his head. The patient didn't survive. A few hours later another guy came in and asked if he could get his axe back. They said, certainly sir, wait right here, and called the police. Walked into the local detox one night for a seizure and find a male flopping himself around on the floor while some disinterested nurses watch. I give the universal greeting of M's. Watcher got before the nurses can answer. The patient looks up at me from the floor and says, hey, man, down here, I'm having a seizure. Then he goes back to flopping. Time to start an IV. Pick a number between 13 and 15. Drawing blood. I had an older woman say, wait, you're going to put it back, right? Number. I'm not. And she freaked out. She didn't know the body will replace it. Once had a patient who was prescribed an inhaler for his cat allergy. He came back a week later saying he was none the better. Turns out he was spraying the inhaler on his cat. When I worked in the Canadian Rockies, we had an incident where a mother sprayed her kids with bear spray as they thought it was a repellent like bug spray. It was 99% cayenne pepper with a 9-foot range. After looking at the patient's chart and seeing she had diabetes, me, do you have any medical conditions? Patient, no. Me, are you sure? You've never been told you have any diseases? Patient, never. Me, what medications do you take? Patient, insulin, for my diabetes. But diabetes is a superpower. I want an STD test, cause I had sex with 2 people without washing my dong in between. Okay, do you know if either of them had an STI? Or do you? No, they don't. But that's how you get them in it. I'm sorry, you get STDs by not washing your dong in between. Woman. Number. No, they have to already have. You should always wear a. That's just bad hygiene. Uncle is a dentist. Said he had this 20-some-year-old come in with a bombed out molar that needed to be pulled. He explains that she is going to lose her tooth and is expecting some sort of negative reaction, which is customary. Her response? That's okay. I'll just wait for the other one to grow in. What other one? Like when I got these, it was because I lost the old ones. Those were baby teeth. These are adult teeth. You only get one set. So nothing will grow in the hole? Shudders. I cracked a molar once and had it pulled. My wisdom tooth took its place. Wasn't expecting it though. 20-something-year-old patient comes to her. Chief complaint on the board is private. This should be good. Go in. He is visibly depressed and sad. Tells a story about how he slept with a woman. Didn't use protection. And after he noticed she had a plastic box on her, when she told him it was an insulin pump for diabetes, he was mortified. Came in immediately to be tested for diabetes. I had asthma when I was a child, so stop freaking patronizing me and telling me how to raise my daughter just because you think you're smarter than me. Leaves hospital. Back in hospital 2 hours later. 6-year-old daughter in respiratory failure and admitted to ICU. Eggs. I ain't no chicken. My house cleaner's teenage daughter was helping out one day, and as I said hello she mentioned that she was pregnant. Again. This will be child number 3, so I comment that at least we know her eggs are healthy. Then I receive the chicken egg comment. I give her the short version of human reproduction and am rebuffed. I promise her that she in fact is full of eggs and hers are in top form. A week later she is back and informs me that a nurse confirmed everything I had said. I gave her insulin because her sugar was low. Also dumping ice water on overdosed drug addicts. That just makes the paramedics wet. As someone with a mom who has type 1 diabetes, I find that terrifying. On a similar note, a lady once tried to give my mother Splendor when her sugar was low. An old man from a remote valley thought that he had got Parkinson's disease because he had been masturbating frequently when he was younger. That's what the church told the young boys to keep them from doing it. Poor guy. I am not a medical person, but I once thought I was having a heart attack at work and drove myself to the ER. I was placed in a bed with a curtain after skipping tridge and getting EKG'd right in the hallway. Of the 5 other roommates separated by curtains was a 53-year-old man that was there for burning sensation in his penis. I know this because multiple people came to talk to him about his condition and he had no volume modulation. What everyone kept asking him was, did you put something chemical in your penis? His response to each one was, yeah, I might have. It took 5 nurses and a doctor before he finally fessed up to what it was. Bleach. He said he dribbled bleach into the tip of his penis to keep from getting an STD. The nurse was silent for a few solid moments before asking why and if he did this every time he was sexually active. He said he wanted it clean, and that he wasn't sexually active at the moment. He wasn't sexually active. He had done it after masturbating, and was under the impression his own semen could have infected his dong with something he didn't want. She then had to lecture him that if he wasn't sexually active with another person, he likely wouldn't contract an STD, and that soap and water are a good way to clean his genitalia in the future. I was frozen in my bed making that face from Edvard Munch's The Scream and my now ex-wife mirroring it back to me. The man was moved elsewhere, perhaps to rebuild his urethral lining, and we were still too shocked to discuss it until leaving the hospital 4 hours later. For future reference, if you think you're having a heart attack, please get a ride to the hospital. I had a patient who drove themselves while actually having a heart attack, and they crashed their car into a tree, so they had a car accident and a heart attack. Nurse here. I once had a 20-year-old female patient who didn't know that having sex would lead to pregnancy. She had no idea. How? At my animal hospital, I've had many people over the years bring in their cat because they found tumors, not knowing that male cats have nipples. I'm never going to have a baby because the hospitals don't wash them anymore. She's 30. Good choice. My non-diabetic patient with a blood glucose of 1250. I'm hungry. Can I eat? Well sir, your blood sugar is really high, so let us get it under control first. Can I at least have a drink? I can get you some water. No, something else without sugar, like juice. You're kidding me, right? In chart. Allergies. Shark bites. It makes me break out in bleeding. A middle-aged lady in theater once told us at the last minute, as she was being wheeled in, that she's allergic to latex. Everyone freaks out because so much of the stuff we use in theater has latex in it, so we take her to the latex-free theater and do her surgery there. When she's in recovery and awake, I inquire as to what reaction she has to latex. I just don't really like the sound the latex gloves make, dear. I just turned around and walked out. I actually have had 2 disease in the last few months. I was rotating in the ER seeing a 20-year-old female patient who came in for a few days of terrible vomiting. First step was to get a urine pregnancy test, which came back positive. I went in and gave her the result and she got this very panicked look on her face that quickly turned to confusion. She looked at me with the most serious face and says, I just don't know how this happened. I have only let him finish in my mouth a few times, but I have never, ever swallowed it. That would just be stupid. The next half hour was spent discussing the fact that she had been having unprotected sex for about 3 years because neither her nor her partner understood how pregnancy occurred. Best part was they apparently usually always used condoms for oral sex, but not vaginal sex. Much education was given on that day. Second, I was seeing a patient in a pre-operative clinic and reviewing her history and allergies. She claims, and firmly sticks to it, that she is deathly allergic to all salt water. Bad, red, painful rash all over her body while at the beach. She was also claiming to be allergic to snow, where she apparently her face got all red and hot after being out in the snow. She was dead serious and had no psychiatry problems. Good news, she got saline and didn't die. I had a patient try to feed her newborn baby a French dip sandwich a few years ago. Work labor and delivery for a few days and you'll wish there was a license required to breed. This isn't the most uneducated but it's pretty classic. I work in pediatric critical care. At my first job we had this kid that was immediately post-op from a small surgery. Doing great. Was probably going to sleep it off and transfer to a general floor the next day. The mom wanted to snow him with drugs and kept on insisting he had pain, which he denied, and had no vital signs or actions to suggest he was hiding. He was getting scheduled oral opiates and Tylenol, but this lady was insisting on something IV. When she didn't get anywhere because the kid kept denying pain, she asked for something so he would sleep through the night and the nurse said, "We can try some Benadryl." And the lady snapped. She demanded a doctor, berated the nurse, and essentially said we were mistreating her child, who was OMG. I'm fine dying the whole time as he played Xbox. The doctor on service was this awesome, brilliant man who was tired of dealing with this lady drug seeking for her kid. He put on a smile, asked what the concern was, listened to her complain about how the nurse had offered the kid Benadryl, cocked his head and said, "Well, what about diphenhydramine? Have you ever tried that? It's a very effective sleep aid. For anyone that doesn't know, Benadryl is the brand name for diphenhydramine. They're the same thing." Immediately the lady perked up and said, "Diphenhydramine? Yes, yes, let's try that." Meanwhile, the bedside nurse is struggling to keep from laughing, says, "I'll go get that," and runs to the Pixies drug dispenser in a locked room, where she loses it. Kid got his diphenhydramine. This reminds me of the time I was mad at my brother, I must have been 12ish, and told him I put deoxyribonucleic acid on his doorknob. My dad was furious. I explained it to them later. Now I'm a science teacher and trying to educate my students so they have some science literacy as adults. My dad worked in a Philadelphia hospital during his residency. He says that one time he was asking a woman about her medical history, and she told him that she was once diagnosed with fireballs of the Eucharist. It took him a minute to figure out that she meant fibroids of the uterus. Fireballs of the Eucharist sounds like a really cool Christian FPS. I'm a nurse who has worked in the burn trauma ICU and I am now a hospital supervisor during the night shift. The stuff that people come into the hospital with is mind-blowing. Either their medical problem or their social problem, or both. My most recent and favorite experience was a patient who called the hospital condition concern line wanting to know why we were not teaching her how to tit feed. The operator who passed the call to me thought it was a prank at first. I go to the mother baby floor to meet with these people and talk to their nurse. I come to find out that the mother has tested positive for heroin in her urine. It also tested positive in her newborn, and she also has a current history of marijuana use and a past history of substance abuse. Her last 3 children have been taken by CPS, and tomorrow, which is 5 hours from now, they decided to make this complaint at 3 AM. Her new kid will get taken away. I go to talk to this woman to explain why we can't teach her to breastfeed due to the drugs in her milk. The stuff that comes from this creature's toothless mouth is unbelievable. Her first statement is, "Your job is to teach my kid how to suck my tit, and I don't know why the hospital is doing this to me. I don't smoke that much weed. I'm cutting back." She ignores the heroin here and thinks it's the weed. And I always feel good on drugs. I talk with her in circles for a little while. It finally ends with her saying, "Frick it, I'm having a smoke." She got up and left, and that morning CPS came to take her kid away. The kid was in the nursery the entire time. I'm told she barely even looked at it since birth. Thank God that CPS took that child immediately. My old doctor said I could keep this pair of contacts for a year. This girl comes in with the same contacts she got as trials over a year before, and she had never taken them out. Not to mention these weren't night and day contacts. These were bi-weekly AccuView lenses. She did not leave very happy that day. I once left a pair of those things in for like 3 days, and it was awful. Those things must have been welded to her eyeballs at that point. Don't eat or drink anything after midnight before his 3-year-old daughter's surgery the next morning. Tonsils and adenoids. While intubating his daughter the next morning, she vomited scrambled eggs, causing her to aspirate them into her lungs. Her heart stopped, and I did chest compressions on her for 25 minutes. We got her back, aborted the surgery, and transferred her to pediatric ICU on a ventilator. Her father's response: "She said she was hungry. I thought you were being too hard on her. It must have been something you did to her." If you're working with kids, just ask them what they had for breakfast. Chances are that they forget that they aren't supposed to tell you. Serious, doctors of Reddit, who are your dumbest patients? I am in a doc. I once had a 20-year-old and his girlfriend come in at 2 AM freaking out because something had tore his throat open. He seemed fine. No blood. Breathing fine. I had him open his mouth. Saw nothing. So didn't want him to lose confidence in me. Clearly something had happened. So I'm looking and looking. There is nothing wrong with this kid's throat. Finally I say, "Look, it seems okay. What do you feel or see?" "I don't feel it, but look, it's right there." "Where?" Looking. It was his uvula. Somehow this kid had gotten to the age of 20 without ever noticing his uvula. Girlfriend was also horrified. I told them it was normal. Did not believe me. So I told them I was about to blow their minds and showed him his girlfriend's uvula. Minds blown. Another life saved in the air. Had an old coot who was sweet but had clearly spent his adult years drinking away whatever brain cells he started with. He presented with a chief complaint of, "I can't drink beer anymore. Every time I drink one, I just throw it back up a few minutes later." Well, turns out Cooter hadn't been able to eat actual food in months, was subsisting on pretty much just beer, and hadn't crap in over 2 weeks. But that didn't bother him a bit, until he couldn't have the beer. Then it was an emergency. He had a big old tumor blocking the distal part of his left colon, so near the end of the road, intestinally speaking, and everything gradually got backed up all the way to his stomach. That's why he couldn't keep a beer down. There was just no more room at the inn. I fixed him with a colostomy, and he got better and left. He refused chemo and I figured he'd just go home and die of cancer. But then, almost exactly 1 year later, he came back to me with just about the same complaint. Obstructed to the point of not being able to drink beer. Except this time, it was that his ostomy had essentially retracted into his abdomen and the skin had nearly grown shut over it. He was crapping out of a teeny tiny hole in his skin. Even my oldest partners had never seen anything like it, but once again Cooter wasn't remotely phased. He just wanted us to fix it so he could go home and keep drinking. I did. Haven't seen Cooter since. I kind of hope he's still out there, treating his cancer with Budweiser and just blissfully ignoring the Grim Reaper. I met one who was taking lactulose, extra strength laxative, for her lactose intolerance. To expand on this, lactulose does contain lactose. Had a Marine once who came to me complaining of a rash to his right forearm C2 weeks. This was his first visit for the issue, and hadn't had anything like this before and was worried, since he reported worsening symptoms since initial onset. When asking about prior skin issues, he told me he had ringworm just prior to this rash. Look at his arm. It looked like a mild second-degree chemical burn in a rather circular shape, with blisters on the edges. What got me was the exact definition and the burn edge. Asking the young LCPL how he got that, he replied, "Well, that's the burn I got from the bleach I poured on my arm." When I asking him why he poured bleach on his arm, well, how else was I going to kill the ringworm? I did that once. Junior high wrestling. Thought it would clear up overnight. Obviously was not cleared to wrestle. Learned my lesson. I was an intern in the air. I have seen a lot of stupid people. It was a small town and all. The worst I think was when I walked in and the floor smelled like, I don't even know. It was by far the worst thing I had ever smelled. I asked a passing nurse what the smell was, and he just shrugged his shoulders and told me someone probably crap everywhere. Well, the doctor is preparing to go into this room, but I did not expect what would happen next. He opened the door, and I almost barfed. It was extremely hard to keep my professional composure. The guy had his leg wrapped up. The doctor asked him to unwrap it, and it was gangrene. From his foot up to the middle of his thigh. The smell I had been smelling was rotting flesh. The cause? The four-wheeler I was riding caught fire 6 months ago. We had a patient once on a PCA, a kind of pain medicine pump with a button that the patient pushes to dispense more medicine. She thought she had to physically lick the button in order to get the medicine. It was weird. I had a patient in her 30s complain of monthly rectal bleeding that would last for 6 days and stop on its own. It started when she was 11. She just thought she should get checked out. It did stop for a while when she was pregnant. There was one who was very upset to find out that she was pregnant again because she'd used her diaphragm exactly as she'd been told. She carefully inspected it for holes, applied the spermicide, placed it, wore it at night, then took it out, cleaned it and put it away each morning, and then her husband arrived home from his night shift. There are several close calls. The patient who fixed an appointment for a pedicure the day after open heart surgery. He said that he'd just sneak out of the ICU and that nobody would notice. The patient who had an amputation of half of his foot and decided that it would be a good idea to walk to the toilet after returning to his room, covering the floor in bloody footsteps because the suture ripped open again. The patient who said that he didn't have any previous operations, but was basically covered in scars. When asked about each of them, he suddenly remembered having about 15 surgeries for various accidents. The patient who forgot that he had his kidney, spleen and part of the colon removed because of a tumor. The patient who decided that he'd never take more than 3 pills a day, because obviously taking more than 3 pills a day is going to kill you. He was on 4 or 5 different meds at that time, and basically just chose at random which meds he was going to take which day. Good thing I don't take pills for my condition. I do, however, randomly choose how many units of insulin to take. GP here. The most outrageous thing I've heard was from a boy who was something like 22 years old. Very poor, illiterate family. The boy had a bad case of tonsillitis and refused to take any meds because all he needed to do was bite the sun. Basically at noon he had to look up to the sun, open his mouth as wide as possible and bite the sun several times so it would burn his tonsils and cure him over the course of a couple weeks. When that wouldn't work, plan B was to do the same at night but only under a full moon. TLDR. Bite the sun and cure you tonsillitis. I worked at the during my internship and met a girl who had increasingly painful and red eyes since a couple of days back. The last 24h had been horrible. I asked about all the normal stuff, and she claimed to have no idea why she had this eye problem. She had never had anything wrong with her eyes. I proceed to drop some dye in her eyes to check them in a microscope, and when I do I realize she's wearing contacts. She didn't like her natural eye color, so she had bought a set of blue colored lenses 8 months earlier. Never removed them, not even during nighttime. Didn't even think to mention this to me. Claimed to have no foreign materials in her eyes. Needless to say, I gave her quite the harsh lecture and a referral to an ophthalmologist. We had a patient come in for theater. When asked if she'd followed the fasting instructions she said yes, but luckily the nurse didn't believe her. With some prodding the patient eventually confessed to having 6 chocolate bars and an orange juice for breakfast. Obviously the surgery was delayed. Had a patient who was convinced that drinking juice with baking soda was helping him fight prostate cancer, but your cancer is actually getting worse. I'm gonna stick with my plan. I really feel like it's helping. They put a dong ring on for a week solid. Turned up with a dong like a aubergine, color and swelling. No way it could be salvaged. Given a full penectomy, as bad as it sounds. Now has a hole between his legs. At least that's the one that sticks in my mind. This is how they castrate sheep and such. A band around the base of the scrotum. They just fall off. 14-year-old couple, splitting birth control pills to be extra safe. Girl gets pregnant. Boy gets gynecomastia. Surgical resident here. One that comes to mind while I was on the cardiothoracic service was a gentleman that came in through the trauma bay with a stab wound to the chest. He reported, after we fixed the rather large hole in his right ventricle, that he was just visiting a friend and while on the stoop of the building, a random stanger stabbed him with a sword from a first floor window. He proceeds to laugh, get back in his car with his buddies and drive home. Despite the rather profuse bleeding from his chest, he drives home for some period of time and then eventually decides he should go to the hospital, but drives by himself to the hospital. Last thing he remembers was being on the way to the hospital. Lucky man was found in the parking lot, had passed out in his car, eventually made it to the OR and walked away just fine. TLDR. Dude gets stabbed in the heart, decides to go home and hang out for a while, eventually somehow drives himself to hospital before dying and without hurting someone else on the road. I'm guessing he panics and thought, there is no way that just happened. Well okay, but it's not that bad. Nope, it can't be. Not a stab wound from a sword. That's a death for past people. When I was doing rounds in the for my medic I encountered this woman. She was in her early 40s and was apparently a frequent flyer for pain meds. Since she had become known in the community, this was a small city in West Michigan. She was no longer able to trick doctors into giving her meds. So what does she do? She pulls out her own teeth. She had tried to do a couple but they wouldn't come all the way out. She did eventually get one out but this was after a few attempts. This isn't the stupid part however. She felt that this may not do the trick. So she waited for a few days knowing she would get an infection and we would have no choice but to give her what she wanted. Well, it didn't work. They gave her NSAIDs and antibiotics. There was the guy whose elderly mother suffered a massive brain hemorrhage and I had to tell him there was nothing surgically we could do for her. He tearfully told me that he would do anything for his mama and she could have his brain to save her life. Dude wanted us to do a brain transplant. I had to tell him that no, unfortunately that would not be possible. That's terrifyingly stupid, but also touching and sweet in a Forrest Gump kind of way. I have the grandma, the mom, and the teen in the room. The teen is pregnant, but this apparently is a good thing. There are no fathers, grandfathers, boyfriends, jobs in the picture, but everyone decided it was about time a new generation was added to the family lineage. Apparently the teen did not appreciate the fatigue, full bladder, back pain, etc. that go along with being pregnant and is also experiencing some cramping pains. She demands that we do a C-section because she's tired of being pregnant, even though she's still not far enough along, because then we can just hook up the preemie in an incubator to finish growing and the government can just pay for the incredibly expensive ICU stay. My jaw just dropped. Dentist here. I had a patient a few years ago who could not understand how she had gum disease on her upper teeth. She thought gravity would pull all the bacteria down onto her lower teeth, leaving her top teeth plaque free. Turns out using cement as a DIY cast for your broken, but not reset, leg is a bad idea. Turns out the chemicals in the cement irritate and dissolve your skin. He became septic and almost died by the time he presented for medical care. Emergency medicine, preventing natural selection one stupid person at a time. When I was a teenager I for some reason thought it would be a good idea to mix up a small amount of concrete in a bucket with my hand. Because, you know, finding a stick or something is so hard. It turns out that gravel is abrasive and cement is very caustic. This is not something I did the second time. I had a patient who came to the emergency department vomiting so much I had to admit him for intravenous fluids. I took the usual history, including what he'd eaten recently, nothing out of the ordinary. A few hours later, he calls me over. Doctor, I did eat some chicken and rice earlier. My girlfriend made it yesterday and we left it in the pan on top of the stove overnight, and I ate it this afternoon. This was in a July heat wave. Do you think that could have been it? Yes, I do. We had a woman that went through 3 hospitalizations for diabetic ketoacidosis in 6 weeks. Her glucose was up to 1100. Her explanation is that she didn't like her endocrinologist, so she refused to go back. Optometrist here. Had a guy come in for a glasses exam for the first time in 10 years and I discovered he had full-blown glaucoma going on and I asked him if I could run a test to help confirm. He got super angry with me and demanded his prescription. I said I'll give that to you but I need to prescribe you medicine to help save your sight. His response was, well, if the good Lord wants me to lose my sight then who am I to stop him? I made him sign a waiver and he left. I've never been so frustrated at a patient. I work as a scribe in the and we had a guy come in asking to be tested because he may have an STD. So we start asking him if he has had unprotected intercourse and multiple partners, to which he answers yes. Next we ask if he has any itching, rash, discharge, etc., to which he answers no. Well, this guy thought he caught asthma from having intercourse with some chick who had it. Asthma. He thought it was an STD. I had a girl come to the for blood spotting and abdominal cramping. She had just started her first intimate relationship and had taken Plan B every day for 5 days because she was worried about getting pregnant. They used condoms and she was already on the birth control. A med student myself and another student took a history from a guy who drank several 10 plus cups of tea a day with 6 sugars in each one for my thirst and had 6 meals a day of 4 bacon sandwiches with butter for the energy. That's all he had every day. That's it. He couldn't understand why his heart disease wasn't getting better, why he'd put on weight, why he was now showing high blood sugar and was borderline diabetic. I, too, cannot understand why he is borderline diabetic. Had a girl in the year who got beer poured over her while at a party. She went to the bathroom to clean herself but didn't find anything to wash herself with, like a sponge or something. So she used the next best thing she found and meticulously scrubbed her boobs with steel wool. And our skincare addiction gets worried about facial scrubs. While in nursing school I had a patient who had wounds on his leg and refused wound care because hospitals are clean and you can't get an infection in a hospital. He refused even after having me and then my instructor explain to him about hospital acquired infections and the need for wound care. Not a doctor, but as an army medic, I have had some dumb patients. One of the first guys I treated got really bad road rash from a motorcycle crash and decided to treat it himself by pouring whiskey on it. By the time he came to the medics, it was pretty bad and I had to do debridement with a scrub brush, basically scrubbing the bad parts off with plastic bristles. He was in a lot of pain and I was trying not to laugh at him. One guy came in with fluid-filled bumps on a red base around his mouth, textbook herpes. I asked him if it was his first herpes outbreak and he started yelling at me for saying he had herpes. He refused to listen to anything else I said and asked for the PA, who took one look at him and asked if it was his first herpes outbreak. We once had a guy who had the tip of his finger amputated. His first question was, "Will this grow back?" One guy had a sore back, and while I was doing the physical exam, he said, "Doc, my spine is curved." It wasn't. That's why my nose is crooked. Took care of a patient who we diagnosed with non-Hodgkin's lymphoma. This sweet woman was in her late 20s. For those that don't know, NHL responds pretty well to chemo. Her father-in-law had a business selling camel's milk. She opted for a camel's milk treatment plan over chemotherapy. She was convinced that camel's milk can treat anything. She said she came to the hospital just to find out what it was that she was going to treat with the camel's milk. SMH. One more I'm telling on behalf of a colleague who doesn't read it. In the wee hours of the morning, he got called to see a trauma consult. It was a guy who reportedly wandered into the ER stating he'd just come from a bus stop across the street from the hospital. He had just woken up there and realized that he was missing his wallet, as well as all of his clothing from the waist down. What, you ask, would prompt an indecently clothed man to march barefoot across a busy downtown road, in a big city, by the dawn's early light to seek assistance in the air? Shame be damned. His butthole really hurt. My friend did an appropriate workup and discovered a large chunk of broken off concrete lodged in this gentleman's rectum. It required an operation to retrieve it. However, before they whisked him off to the OR, the patient confessed the rest of the story. He'd hooked up with 2 strange men off of Craigslist, and they'd gone out in one guy's awesome sports car, used copious amounts of illicits and eto, and done. Well, at that point, he wasn't too sure just what they'd done. All he remembered was waking up at the bus station with no pants and a rock up his ass. And then, while my friend was still in the OR with the guy getting consent for the operation, the patient's very worried wife walked in. Doctors, medical examiners, morticians of Reddit, what is the weirdest anomaly you've ever found in a body? A mummified fetus. I was working in Africa and the usually very stoic Congolese surgeons called me into theater, gagging. The patient was an elderly woman with a protruding abdominal mass. When they opened it, they found that it was a long dead mummified fetus which, as a result of an ectopic pregnancy, had somehow managed to both wall off after it died and somehow avoid killing the mother. Her body had encapsulated the alien tissue and over the years, it had slowly eroded her anterior abdominal wall to the point where it finally caused her to have enough symptoms to get something done about it. It was horrific and the smell was worse. Happily, though, the patient survived the procedure and just left the surgical team with a memory. When my mom was a mortician, I would hang out in the mortuary watching TV. Her boss showed me a guy who had retained water and drowned. His balls were the size of a grapefruit. Not the most pleasant thing to see at age 15. When you poked him, he moved like a waterbed. In med school I had to do a pelvic on a woman during my EM rotation and found her M pipe. She forgot she put it there during a traffic stop. I also had to remove a nail from a guy's head. He figured it must have went off while reloading. He had intractable tooth pain, so he got sent by his dentist for a CT and lo and behold there was a nail in his cranium. Guy came in for an outpatient MRI of his cervical spine. On the form where it asks if he ever had any metal in his body specifically asks if any injured by a metal object. He selected no. Same with a verbal questionnaire. Also we do a keyword search in the patient's heart chart for the term foreign body in case it's documented nothing came up. He lays down, and I start taking images while talking to him though the speaker. During one of the image sets he starts pounding on the inside of the scanner and screaming. Figured he was claustrophobic so I stop the machine and get him out. Immediately he jumps up and starts talking nonsense and runs into the wall, screaming he needs to get away from the ocean. I call overhead for emergency room staff to come down and security as he's flailing. Continues screaming and running into the wall before we restrained him. The staff rushed down, and he's talking a mile a minute and explaining how he is inside of the poster of the beach that covers the entire wall in the room he's in, scared out of his mind and hallucinating. Security restrains him, and he's taken down to get an X-ray of his skull. There was a BB in his frontal lobe. It had just enough ferrous metal left in it to travel a few millimeters in his brain. In the emergency department he kept trying to escape, and was very fast. While unrestrained he got up, somehow convinced the guard he was better. Patient bolted out of his room into the main hallway. A code was called for a lost patient. For over an hour nobody could find him, until a nurse looked into a large storage closet. Poor guy was found in a pool of blood. He crashed into a large mirror that was leaning on the wall, and had severe lacerations of his neck, face and arms. Efforts were made to transfuse him but it was too late. Still haunts me how a simple BB from 40 years earlier could do that. Discovered his brother accidentally shot him with a BB gun when they were kids. Did an autopsy once where the patient's plasma separated from the blood. One giant plasma ball. It was really weird. The weirdest thing I've ever faced as a doctor is also by far the saddest, and I still think about it every now and then. 5-year-old kid with oropharyngeal cancer caused by human papillomavirus warts. She had been sexually abused since she was 2 years old or even younger by her father, which was now in jail, and got the cancer because of continuous oral abuse that caused papilloma to grow on her throat. But no mother in sight. Was being raised by foster family. When she arrived to us, the growth was already blocking her trachea and eventually she underwent surgery to remove the tumor, then chemo, then other 5 different surgeries. When I stopped working there she was breathing through a tracheostomy hole and still under treatment. Bad prognosis. It's been 5 years since I left and she is probably dead by now. And it haunts me because no one told me in college that my profession would make me see the worst part of mankind. Doctor here, general prac and young, so not many experiences. I had this kid, 8, and his mother come to the petridge about a cold. As soon they came in they filled the room with stench, like a wound festering, that humid and rancid smell. Kid had a runny nose, but secretions were coming from a single nostril. Upon examination we found the sinusal cavities filled with cotton. Apparently the kid had this funny idea of stuffing one nostril with cotton and shoving it up inside with a stick as far as he could. We had to call the specialist to remove a lot of very deep cotton that was of course a picnic field for bacteria. Kid probably isn't going college but he won't be lacking new ideas. Neurologist here. We don't get as many cool stories as the docs. However, when I was a medical student we had a cadaver with a very large and very tiger-striped tattooed dong. This was the only tattoo this man had, and was very unexpected when it came time to genital dissection. Obviously, this was saved by the staff for use on all of our anatomy exams. You walk around the room to different parts bodies and identify whatever is tagged, and this specimen was always identifiable by the only laughing medical student as they kept rotating around the room. Imagine donating your body to science only to get your dong cut off and laughed at for years more after your death. Father owns a crematory. We once cremated a man, with no clothes and not in any container, and along with his ashes came a massive belt buckle. I kid you not, we have no idea how it got in him but it was definitely there. You can take the man out of Texas, but you can't take Texas out of the man. Teratoma consisting of a couple molars as an incidental finding in a pelvis x-ray. It was in the patient's uterus. Guy in his 20s who had a neck x-ray. It was discovered that the peg holding his head onto his body was congenitally absent. Sonodontoid. It's probably a good thing he never played football. My dad had a patient that slipped and fell on a whole mayonnaise jar. Weirdest thing was in a woman's intestine, a dead mouse. Tiny little thing. Obviously never got the chance to ask how the mouse got there as this was post-mortem. Definitely unexpected though. She probably swallowed it to catch the spider. My colleague was embalming an autopsied male and found 2 hairnets, numerous plastic tissue sample slides, a plastic urine container with another person's name on it, and over 27 latex gloves within his abdominal cavity. A nurse. Man comes in after a car accident. We do a brain scan for safety and find a 3-inch nail embedded in his brain. Ask man about it. He says he has no idea. Admits he was once shot with a nail gun but had no idea a nail had been lodged in his head. Had been there for well over 4 years. Interned with an ME and we had a case where the death was very sudden. He didn't really complain about any pain or anything, and then was gone. We open him up and there's blood behind a kidney, almost an entire liter of blood in the cavity, with no sign at all of internal bleeding. Not really fitting with the question posed, but a medical oddity just the same. My mother-in-law miscarried twice before she had my husband and his twin brother. She had some kind of cyst or protrusion in her uterus that once one of the previous fetus got to a certain week of growth, it would rub against the protrusion and rupture the sac, and the fetus would not be at a point of viability and would perish. So when she became pregnant with twins, she knew inevitably she would sadly lose them at that stage. The time frame comes and goes. Fetuses are still okay and growing normally. Comes time to have them early as with twins, and lo and behold, not only are they in the same amniotic sac, but the other twin's sac is around the one they shared. They were double bubbled. They had twin transfusion syndrome, so no one at the time had a moment to think about it, life or death emergency at that time. But the fact that they were double wrapped is more than likely the only reason they made it that far. They both survived the twin transfusion. Very rare in the early 80s for one if not both to die. Just an amazing story, I think. A real grub inside a tooth. An old patient came to us with a long-term and several pain in her tooth. The doctor extracted the tooth and put it into a tray. After 1 minute, we saw a grub crawling out from the tooth. This woman had lived with it for at least 6 months. One of our cadavers had 2 spinal cords, aka split spinal cord malformation. I worked in medicine as an X-ray tech medical assistant. One day we had a patient come in complaining of a stomach ache. Considering the time of the year, it wasn't an abnormal complaint to have come in our family practice. So we run him through the normal test urinalysis and an abdominal X-ray, cub for those medically inclined. Well, he was a shorter fella so I had a lot of room on the film. This kind of X-ray is one large shot centered on your belly button. It's mostly used to see how full of crap you are. I went to the dark room to process his film when something weird could be seen near his butt. There was definitely a lot of poop backed up but I couldn't tell what was causing the blockage. I showed the doc the film and she busted out laughing. The doctor I worked with was usually stone-faced and serious about these kinds of things. So it was odd. We were all confused. She asked me to go into the room with her while she asked him some questions. The first thing she asked him was what he shoved up his butt. I was so taken aback by this statement I almost missed what he said. You see, this 40-year-old man has diarrhea the week before and decided to shove a tampon up his butt to stop it. He tried to take it out but the string got caught, and then he simply forgot about it. We had to remove it. It was disgusting, and I never did another procedure ever again. In my anatomy lab, my group's cadaver had died from systemic complications of stage 4 lung cancer, and when we got to the lungs they were 2 rock hard, necrotic blackened masses that look nothing like the other cadaver's pink and spongy lungs. My anatomy prof took one lung out and wrung it, resulting in this putrid black goo flowing out of the lung. As he was draining the lung, he mentioned in an Indian accent, This is what happens when you smoke." Heard a story from a urologist when I was in medical school about a guy who came in for a vasectomy. During the procedure, the urologist has trouble finding the vas deferens, so he orders a few tests, Turns out the guy has bilateral congenital absence of the vas deferens, CAVD, but the guy had 3 kids. And Lucy had some splaining to do. She isn't dead, but this week I saw a patient with endometriosis in her lungs. Somehow, womb lining cells had traveled to her thorax and colonized on the lung. She previously had symptoms of coughing up blood while menstruating, but because the endometriosis was so severe, was on the pill to stop her periods entirely. Then she came off it to have a baby, and after the birth, with her hormones all over the place, she developed 2 pulmonary embolisms, blood clots in the lung, and a few weeks after that, 3 successive pneumothorax, collapsed lung. The womb cells had tried to shed, and made a hole between the airways and the sac surrounding the lung, letting air escape. She's deciding now whether to let the surgeons cut out the part of her lung with the endometrial cells, to go back on the pill for life, or to have a full hysterectomy and remove her ovaries. Tough choice at 32. Physicians of Reddit, what's the worst injury you've seen at a routine checkup? First year nursing student in LA, and I was at clinicals when a guy who I had to do a physical assessment on, all we could do since we don't know much, tells me he's been hearing strange cracklings and noises in his ear. I check his ear and it is filled with so much wax and whatnot. Call my RN advisor and she proceeds to clean out the guy's ear. What does she find? Fricking fruit fly nest. Yay, the medical field can get pretty rad. It's always insects. It's never a puppy. Not physician, but x-ray tech. Had a patient walk into the urgent care for hip x-rays. Her order said it was for hip pain, which is pretty routine. Turns out she had walked in on not 1, but 2 fractured hips. Cannot even freaking imagine how painful that must have been. ED doc, so hardly a routine visit, but a guy comes up to the fridge window with his arms over his head, palms of his hands pressed against his ears. I'm in tremendous pain, he says when asked what's wrong. X-rayed him and found he'd broken his neck. He'd been walking around with it for 3 days. My brother once jumped on the front of my white car, grabbing the front pillars with his hands. I closed the door and caught his finger, which he pulled out quickly, as you do, but there was a tiny chip of paint that had come off the car and got lodged under the skin somehow. He must have spent a week or so chewing on it to try to get the paint out, but it just wasn't working, so he went to the doctor to see if he could help. After checking it out, the doctor tells him, the reason you can't get that out is because it's your bone. Apparently when I shut the door on his finger, I'd broken the tip of his pinky enough so he could see the bone through the skin, and he'd spent the next few days trying to pull his own finger bone out with his teeth. Welp, this was the one that made me put the phone down and just stare off into the distance. This was not a routine medical exam, but I was a tridge nurse in the OR when a patient calmly walked up and reported a complaint of pain in my side. He failed to mention the blood in the handle of the butcher knife sticking out of the left lower quadrant of his abdomen. He was a homeless schizophrenic who had been stabbed and had calmly walked into the ER and waited his turn to be seen. I am just glad he came in at all. We also get a lot of people who come in for other things, a sore throat or a cough. And when doing a skin assessing we find huge pressure ulcers or gangrenous feet. I have twice had a patient's toe come off when I removed their sock. Neither time had they come to the ER for that issue. A patient who had a routine checkup at his ophthalmologist, eye doctor, who found a small spot in his retina, was referred to a university hospital. Tests showed it was metastases from a small malignant melanoma he had on his back. Our professor cancelled our lecture because he had to tell this otherwise healthy man that he probably only had a couple of months left to live. One of my parents' oldest friends had a similar story. Went for their annual eye test. Optician suspected it was a detached retina and sent them straight to hospital. Turned out it was retinal cancer. Almost 7 years later and, fingers crossed, all is well now. I was working at Target, lived half a mile away, so I walked to work. It totally sucked, but I was out of shape and have cold-induced asthma, so I ignored it. At this time I was picking up shifts left and right, so sometimes I was closing the coffee shop, sometimes coming in at 4 AM to unload the truck. I was basically a zombie from what I assume was lack of sleep. This goes on for a couple months, until I had my annual physical. I was joking with my doctor that I was super exhausted from work, and I must be getting out of shape because that half-mile walk to work really sucks. Turns out I had severe pneumonia. One lung was totally full of liquid and the other had some liquid too. The doctor couldn't believe I was still up and about, let alone walking to work and whatnot. Junior doctor from Australia here. I had a young lady come in for a pap smear. She was chatty and relaxed, not nervous at all. She lay on the bed and I got the speculum ready. I opened it up and instead of seeing her cervix I saw a kiwi fruit sized blob of bloody tissue just hanging out in her vaginal canal. It was one of my first pap smears I ever did, and I had a sudden bizarre thought that I had broken her vagina. I hadn't though, it was just a big uterine polyp that had emerged and was in her vagina hanging by a thread of tissue. She was mortified although I tried to reassure her. This was in a small town and later that day I went to the bakery to get some lunch and she was behind the counter. The most common surprise I see is patients in long-term marriages etc who come up positive for chlamydia. From Australia, kiwi fruit-sized blob of bloody tissue. Yep, checks out. Bloody kiwis. Mum's a nurse and told me about the time a bodybuilder came in with a pulled muscle somewhere in his abdomen that was causing him severe pain. Long story short, the guy was riddled with cancer. It was everywhere. Apparently he was dead within 72 hours. Not a physician, but I was doing medical service in Guatemala and we had an older gentleman come into our clinic to have a checkup, and the entire time he sat there with us, he was resting his arm on what we thought was a bag or purse on top of his leg. At one point he goes to move, and we see a huge lump underneath his poncho, what we thought was his bag, and ask him about it. Turns out it was a tumor that had been growing for around 10 years on his leg, and he wasn't even going to tell us about it. I was putting a patient with mild breathing difficulty on a COPD research study. He remarked that he had been healthy as a horse all his life. The next day, his routine chest x-ray showed metastatic lung cancer. He was dead within 2 months. My best friend of 24 years went to his doctor complaining of heartburn. They gave him medicine. Went back a month later. Different medicine. Went back another month later. Still not cured. They scoped his stomach. Stage 4 stomach cancer and he was healthy and athletic. He passed away 2 weeks ago after 18 months of fighting it. Guy shows up for a discharge physical. Marine. Noticed what looked like cellulitis on his leg. Turns out it was a brown recluse bite that he ignored. Had a fist-sized hole of dead tissue in his leg. We treated it with maggots for a few days. It healed over with a very nasty dent scar. Not a physician but did EMT work while deployed for local nationals seeking help. Had one guy get carried in from the nearby village and we're called out to the EC to see what we can do. For a toothache. He's barely responding when we arrive and smells worse than death. Still makes me gag thinking about it. Start doing the usual initial contact assessment and he's in bad shape. Vitals are all low. He's hardly there, and pus keeps oozing from his eyes and other orifices whenever you touch or apply any pressure to his face, which feels like an old soggy banana. Come to find out he's had an infection for like 10 years and it's spread throughout his skull, neck, and into his chest. A single tooth. Long story short, he died not too long after that while we were waiting for transport. The dude went down cause he didn't take care of an infection. Never seen anything like that and doubt I will again. Guy comes in for an eye exam. I note one eye seems a bit redder than the other. He tells me it's been like that since a branch snapped back and hit him in the face 3 months earlier. I look under his upper lid and there is a piece of wood the size of a tic tac embedded in the underside of the eyelid. Cannot believe it did not bother him more. One time my eye was kind of bugging me for a few days. I was rubbing it and looking at it in the mirror when I noticed a tiny little hair in the corner of my eye. I got it with a tweezer and slowly pulled out an 8-inch long hair from my eye socket. It went way back too. Felt totally bizarre coming out. It was also coated in eye goo. I have no idea how it got in there. Eyes are weird. Went to go see my doctor for a checkup. Had chest pains waking up that morning. Started to feel like someone is sitting on my chest. Walked 15 minutes to the physician's place. And apparently after he checked my breathing he told me I had to go to the ER to get my lungs x-rayed. Spent a week in the hospital for having a 40% collapsed lung. Doctors called it a spontaneous lung collapse. Really not the kind of spontaneity I'm looking for in my life. Spontaneous pneumothorax. Incredibly painful. I had one at 25 while brushing my hair. I went to an urgent care and someone must have miscommunicated to the doc because I rolled into a room in a wheelchair and doc asked me about my cold. I said I don't have a cold, but I'm not sure what I did to my leg and rolled up my pants. My kneecap was on the side of my leg. They seemed rather surprised. They told me to go to the ER immediately. Slightly confused by how someone mixed those two things up. We just got a guy in with Fernie's gangrene from a very alarmed family practice doc. His nuts are in his thigh now. I am warning everyone, don't fricking look it up. Heard this story from my aunt who works in a eye center. One day this woman came in with her friends, all drunk and high as frick as crap. She was holding her eyeball. Somehow she managed to get hit in the face by a pair of heels and it pulled out her eyeball in the process. The kicker is after surgery and all that, she still seemed cheerful and even asked my aunt when her eyesight would recover. Apparently she was under the impression that her eyeball could be reattached. I'm the moron patient. I had fallen through a ceiling 3 years prior and had just worn a knee brace. My employer required me to go to the company doc for a yearly physical. I'm not a doc, so I can't gauge, but here's the list that came out of that visit. Torn meniscus, ACL, rheumatoid arthritis, Hashimoto's disease, and the place I went had in-house genetic testing and the doc suggested that I should get tested since I had Hashimoto's and rheumatoid to help determine what else I had. It was out of pocket, but I thought, why not? I'm sure it was one of those upsell sort of deals, but it really paid off in my case. Test found all kinds of crazy crap that I carried but don't have as of now. Most of it autoimmune related, but found Thompson's disease, which is what those fainting goats have that cause them to faint. In reality, my understanding is that they don't faint. Their muscles involuntarily lock up, and they just physically can't get up. I have a mild case of it that only affects my arms, but it's estimated that like 1 in a million have the mutation. I have to wear a brace on my arms from time to time if I have to make a very quick movement. I'd had a lot of unexplained muscle soreness that suddenly made sense. Another weird side effect I have is that I have trouble swallowing food from time to time, and if I go all day without eating, it's almost impossible to hold my eyes open by the evening, and it has nothing to do whether I'm sleepy or not. Here's my primary care now. Amazingly thorough. My god, I wish I had your doctor. Pre-registration optometrist here. Had a lady present recently for an eye test following months of very painful headaches. She had scans done at the hospital recently and everything had come back normal. The only reason she was in for a test was that her eyes were the last thing she could think were causing it, and she was due for a checkup anyway. Cue me looking into her eyes and finding her optic nerves in both eyes, which usually lie flat against the back of the eye, swollen and pressing forward, with massive hemorrhages in the nerve fiber layer of her retina. Naturally, the hospital was phoned and she was seen within the hour. The swelling had been caused by raised pressure in her head, a potentially life-threatening condition. As far as I am aware, the neurologists are now on top of it and she is recovering well. Scary stuff, as I had only been qualified 2 months at the time. Y'all make me want to get a full body exam. I've read some crap. I'm with you. Reading these makes me think there could be a billion things I have that could kill me. Mine's nothing on the few things that are here, but I can share something I found myself. I'm an ophthalmic technician. Basically, my job is to do the diagnostic scans and workups on patients before the eye surgeon sees them for routine consultations. One lady came in, referred from her optometrist for cataract surgery. The optometrist did note she had slightly higher than normal pressure in one eye at 23, normal ranging typically between 10 and 20. When I checked her pressure, it had risen to 35. Normally straight after this I would dilate her eyes so the doctor can see inside. But I told the lady that based on a hunch I wanted to do a scan of the angles between her iris and cornea before doing that. I found that these angles had closed. Basically, due to her growing cataract, her iris had pushed out, blocking the gap at the outer edge of her iris where the fluid in the eye generally flows. Because of this, the fluid in her eye was very quickly rising. Acute angle closure glaucoma isn't rare, but if you dilate someone's eye who has it, you close those angles even more and eye pressure continues to rise rapidly, causing death of nerves in the eye. I'm just a tech, but thanks to my hunch and scanning first, I could have saved her sight. The doctor performed laser treatment that day to hold those angles open until her cataracts can be removed. Diligence. More people need it. Good save. Nurse. But some guy came in with Lafert 2 and 3 fractures. Said he fell and hit his head on a tractor step about a week ago. Was just coming for medication refills when we asked about the mild facial trauma. Tiny laceration. Unremarkable bruising. Denied all pain medication. And very minimally accepted it after surgery only because we practically talked him into it. Maxillofacial surgeon was excited about it. She came down personally to get him and take him up to surgery. I love when surgeons get excited about things. Not a routine checkup. A woman 36 weeks pregnant comes into the doc in the box complaining of nausea, vomiting and pain between her shoulders. We ultrasound her abdomen. Everything was fine with the kid. Somebody had the bright idea as long as the ultrasound was out to ultrasound between her shoulders. To our astonishment, she had a huge dissecting aortic aneurysm. She had to be survival flighted to a level 3 place and have a crash C-section and her aneurysm fixed. The aneurysm was at least 5 centimeters across. She and the baby both made it. Not me, but a friend of mine worked in the ICU and he once told me about a girl who came in that was on a jet ski and her bikini bottoms got caught on something and ripped her entire bottom open. Vagina to butthole completely ripped open. He said that stitching her up was incredibly awkward because she was a little drugged and super flirty. I am always wary of loose item ends that can be snagged somewhere, like a scarf when go-karting, etc. But I thought that a bikini was tight enough to be safe. A girl in Turkey was decapitated while go-karting because her scarf got caught in the rear axle while she was driving at speed. Yes, there's an aftermath video on the internet. No, don't look it up. Doctors and nurses of Reddit, what was the creepiest last words you heard from a patient right before they died? I don't care that I'm not a nurse, but this was said by my dad to the nurse, so close enough. Backstory, dad had MES. He'd had it since he was 18. Diagnosed at 20. Married my mom at 24. Had me at 29. Died 15 days short of 45. 6 months before that, he was put on hospice. He and mom were discussing funeral arrangements, and my mom jokingly said, "You know Tim, the best thing you could do would be to die on a Wednesday. That way we can have the body prepared on Thursday, the viewing on Friday, and the memorial on Saturday, so more people could come." The morning we got the call that it was time, my mom, 2 sisters, and I were about 5 minutes too late. After we said our goodbyes, the nurse pulled my mom aside and asked if that day had any significance. It's not even 6 AM yet, so mom doesn't even know what day it is, much less if it's important. The nurse tells her it's the 21st of May. Number. Nothing is coming to mind. The nurse told her that the previous day he kept asking what day it was and they'd tell him it was the 20th. He'd look irritated but accept it. That morning, he asked what day it was, and they said, "It's Wednesday, the 21st of May." He smiled, squeezed his favorite nurse's hand, and was gone almost immediately. It was Memorial Day weekend, and we did just as he and mom had planned. And despite many friends being out of town for the holiday, we had over 250 people show up at the memorial service, overflowing the tiny church more than it had ever been filled. To his dying day, he was trying to make things easier for our family. I miss him. Hey, out of this whole thread, this one got me the most. People who think of others in their last moments are really the example we should all live up to. Thanks for sharing. Hugs for you. But I don't know how to get there. Grandpa in hospice. Hadn't spoken in days. Died about 2 hours later. Yup, that's creepy as all frick. I overheard an old lady whisper this to her old husband dying of kidney problems. "You are going to beat this. You got away with murder. This is nothing." Got away with murder is often used as a metaphor for pulled off some dodgy risky crap. Or, you know, he killed Summerson off a beach. I work in a cardiac ICU. We had a patient who had a pulmonary artery rupture, a rare but known complication of a Swan-Ganz catheter. 1 minute he was joking around with us and the next bright red blood was spewing out of his mouth. His last words before he died were, "Why is this happening to me? It still haunts me years later." I can't imagine how awful that was. Nurse here had a patient come into the ER with shortness of breath. He started deteriorating in the ER, and then quite rapidly on the transport up the ICU. We got him wheeled into his room, replaced the ER lines and tubes with our own. and transferred him from the transport stretcher to his ICU bed. He actually did most of the transfer himself. He didn't say anything, but just before he died he pleasantly adjusted his own pillow, laid his head down, and then his eyes went blank. This man just made himself comfortable before laying down to die. I'm a nurse and was previously working at an assisted living community on the dementia Alzheimer's unit. My very favorite patient had been declining pretty steadily, so I was checking on him very frequently. We would have long chats and joke around with each other, but in the last 2 weeks of his life, he stopped talking completely and didn't really acknowledge conversation directed at him at all. I finished my medication rounds for the evening and went to see him before I left. I told him I was leaving for the night and that I'd see him the following day, and he looked me in the eyes and smiled so genuinely and said, "You look like an angel." I thought it was so sweet because he had not seemed lucid in weeks. He died the next morning. It really messed with me. Whoa, that put a tear in my eye, and I'm not the kind of guy to have that happen to me. You obviously had a very positive effect on the final weeks of that man's life. Hold your head up high. My grandfather on his deathbed said they have no eyes. Still give me chills. The long troll. My dad fell into unconsciousness around noon. We managed to get him into bed and he responded with a hand squeeze when I said I love you. We watched and waited the rest of the day. Around 3 AM his breathing changed, and as his breathing became more and more labored he bolted upright, eyes wide open, looked at his wife, my sister, then me, smiled, exhaled, and died. My first hospice case. She was on morphine and started mock smoking. She looked at me, took my hand and said please in the most pleading voice I've ever heard. I sat with her body until the coroner arrived. She has no friends or family. Only her lawyer showed up. I've only done one hospice case since. That's so sad. She must have been so lonely. Get home safe, little one. It wasn't what he said. He said the same thing to me anytime I had him as a patient for the evening. It was how he said it. He gave me this look and paused like he knew. The DNRs in my experience always know when it's time. It's creepy. Relieved. They're relieved when it comes. Most of my patients were older and usually happy that they might see their friends and family again. Relieved that the pain will be gone and that they won't be lonely ever again. Speaking of, if you have older relatives that aren't buttholes, please visit them. They miss you. Cardiac IQ. Had a gentleman who was DNR on comfort care. He was demented and was cursing like a sailor. He seemed to have moments of clarity and would ask to see his brothers, who were both passed. After a particularly worrisome heart rhythm, he went back into a sinus tachycardia and looked me in my eyes and said, "Hey, what's your name? Kabsk. What do you do here?" "I'm a nurse." After this, he was quiet for some time. Then he said, "Frick you," and then he died about 20 minutes later. I can only imagine what was going through his mind as he passed. Nailed it. Ugh. I was a hospice nurse for many years. Super gratifying job for a nurse. Surprisingly, as a regular nurse, you are rarely offered thanks. Hospice nursing is an island into itself. Mostly peaceful, lots of times sad, often a blessing. This is sad, but also creepy, and I wouldn't believe it if I hadn't seen it. Had a 20-year-old kid, gang member, who was dying of primary liver cancer. Super unusual, aggressive, and terminal. He was angry at the universe. His family was there to comfort him, but he literally spit in their faces. Every ounce of energy he had left was angry and mean and ugly. His mom would beg him to lighten up and accept Jesus into his heart. He would swing at her and tell her to F herself. The family remained beside, in hopes he would chill out at the end. His last day, hours, moments. He was angry. The family called me into the room and told me they thought he was going. He wasn't responding. Cheyne-Stokes breaths, eyes glossy and skin cold. The end was imminent. His lovely mother, in her dearest attempt, whispered to him to go towards the light, to her Jesus. With his dying breath he opened his eyes, looked at her and said F your Jesus. A second or two later, he slowly turned his head to the left and got the most horrific look on his face as if he was looking at something we couldn't see, and horrified, like in a bad movie. His face contorted, and he screamed with his last breath, eyes wide, "Oh crap, oh crap, oh hi on you," then made a guttural noise and promptly fell back into the bed and died. Every family member was shaking and too frightened to speak. and I left the room and took 2 days off. I don't care if I never find out what he saw. Well, he was angry at the idea of Jesus, right? So maybe Jesus showed up and took him to heaven and now he's up there sitting in a corner scowling. My grandma died in 1989. My grandfather, Bob, died around 1965. She never remarried, never dated, but she did have a great life. When she was dying she yelled, "Bob, Bob, here I come. Oh honey, I've missed you so much." We always joked that we were glad she didn't yell, "Bob, who the heck is that?" My mom was watching over my great grandfather in the hospital. He'd been unresponsive for a day or so, when suddenly he said, "It's about dang time you got here. I've been waiting," and then he died. I found one of my comfort measures only patient standing at the side of his bed. It surprised me because he had been mostly unresponsive during my shift. I helped him back into bed and he asked me why all these people were in his room. He suddenly became quiet again and I noticed he wasn't breathing. He was a DNR, so there wasn't anything to do to try to bring him back. Looking back, he may have been talking about me and the CNA that was helping me get him back into bed. But who knows what or who he was seeing the last minutes of his life. Still creeps me out a little when I think about it. My father-in-law sat at his mother's bedside for days as she was dying. She was in and out of it and spent a lot of time in conversation with her parents and siblings who were all long dead. One of the last intelligible things she said was, "Leave the gate open, Rodney, I'm coming." I'm an apprentice funeral director. We went to a nursing home on a removal and as we were walking down the hall, one of the patients got antsy and opened the door to his room and saw us walking with the stretcher. "I'll see you next week, boys." And guess who we had to pick up the next week? It never ceases to amaze and entertain me how gallows humor makes it into our lives. DNR patient was on comfort cares, was on a high dose of morphine and hallucinating. She would alternate between grasping for things not there and trying to climb out of bed. She was too unsteady to walk, so my job was to sit in the room and make sure she was safe. She tried to get up and I went to ask her what she needed. She grabbed my arm and pulled me down towards her face and said, very angrily, "Kill me." That one fricked with me for a while. I was in the hospital for a week on morphine. After a while that stuff really starts to mess with you. Checked in on a patient before the end of my shift and she was in good spirits. Had been joking with me the whole time. Her condition was tenuous, new trach, but she had been positive throughout. I asked how she was doing and she replied by singing "The Old Grey Mare Ain't What She Used to Be" and wished me a good night. I came in the next morning and she had coded and died overnight. Last year, my grandfather started desperately pleading for his life with his German captors from World War II. The doctor present was smart and said in German, "You are free, Herr Caricature. You are free," and then he died. That was nice from the doctor. Came into an early shift and was handed over a patient who'd been very anxious and had a panic attack overnight. He was anxious all morning but obs all fine, ECG fine, and so I just asked someone to sit with him to keep an eye on him, reassure him for me. He gets worse, really panicky, heavy breathing. He's on his side in the fetal position. But doctors will be in 10 minutes, so I tell him I'll get them to him as soon as they come in, but ask if he'll lie on his back for me to help his breathing. He tells me he won't make it until they get here and that he won't face the other way. Ob's still all fine at this point, but he's more agitated, so again I suggest he move position for comfort, and that's when he says I won't make it until the doctors get here. If I turn to face the other way I'll die. He repeated this a few times to me. He arrested literally as the doctors walked in and he died on the side he'd been refusing to turn to. I'm convinced he knew. If I turn to face the other way I'll die. That was my exact same thought the first time I had a panic attack. Back when I was a CNA, this one resident fell off a bike for exercise in PT and seized. They came to and became lucid and said, "I think I'm dying," but everyone in the room assured her that wasn't going to happen. She seized up and was dead within minutes. Paramedic, 17-year female, car crash. Please, please, please. Don't tell my parents I was drinking. See you there. That seems more reassuring than scary in my opinion. You're not gonna believe this. Talk about a cliffhanger. Can't wait for season 2 of Old Man with Heart Failure. Dang you, I laughed pretty hard at this. Not a hospital story, but according to my family my great-grandfather was unresponsive his final few days, but suddenly sat bolt upright in the bed and then had a huge smile and raised his hands out as if greeting someone. Then he fell back and died. It was the same with my brother, but he didn't sit up. He just smiled, lifted his hands up and out, and died. I've commented this somewhere before but it stayed with me. I'm an RN and while I was a student I was caring for a lady who had end-stage renal failure, had a DNAR and was shutting down. We were having a little chat. Well, I was chatting away while helping her put on some lotion, when she stopped, looked over my shoulder and said, "Bill's here, love. I've got to go," and swiftly stopped breathing. Read her old notes and Bill was her deceased husband. Intubated PT wrote on a clipboard, "If this hurts, I'll get you." Just before the surgeon pulled out the PT's chest tube. Post open heart surgery, the tube ripped one of the coronary grafts. He bled out in about 5 seconds. You have been visited by the dinner doggo. Good and also tasty stir fries will come to you if you comment. Thanks for the recipe, dinner doggo. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day you magnificent people.